Thank you very much for joining us on the program Healthy Living. I'm Adisuwa Osa-Owage. Today on the program, we want to look at oral cancer. I am sure you are wondering what oral cancer is. We're going to look at preventive measures, what it is, everything that has to do with it. How often do you go to the hospital to do things about your mouth? It's easy for us to run to the hospital if we have a fever, we have a cold, we have a headache, something we can see. But mouth is one place that a lot of us don't even care about, so to speak. Something as small as halitosis, people don't care about it, but it's something that you can actually treat. Sometimes people say, oh, I've got holes in my teeth, I've got holes in my mouth, I've got some scratches on my tongue. Have you really taken time out to go to the hospital to see what is happening in that area of your mouth? I don't think I've ever seen a dentist anyway, but some persons do are in my shoes. So join me as I make welcome experts in this field who are going to be talking to us on what we are looking at today. So I would like to introduce the gentleman in our midst first, because we are two females and a guy here. So join me as I make welcome Dr. Dickson Oko, is a consultant oral pathologist from the Federal Medical Center, Asaba in Delta State. It's nice to have you join us today.
Thank you so much.
All right, seated beside him is Dr. Mercy Oko, oral medicine consultant and a lecturer at UBTH and UNIBEN. It's nice to have you on the program.
Thank you so much. Thank you.
Okay, when we talk about oral medicine, oral health, exactly what are we talking about before we go straight to what we're talking about today? So let me ask you, Dr. Dickson.
Okay, well, oral medicine is actually a branch of dental surgery.
Okay.
That has to do with diagnosis and treatment of people with oral lesions, with oral disease conditions that present to the hospital.
Okay.
Okay, so it covers diagnosing and then treatment, because as a matter of fact, a lot of people have conditions that do not need surgery per se in the oral maxillofacial region. And when I say oral or maxillofacial region, I'm talking about the mouth and the surrounding structures and all the tissues that make up the mouth. The lip, the gum, the gingiva, the tongue, the cheek and all that. So there are some conditions that do not need surgery, surgical interventions. So oral medicine, they're like physicians that are in charge of issues that affect the oral health, mouth health, that do not require surgical intervention. So there are a range of conditions that can present that needs the attention of an oral medicine specialist.
Okay.
Why an oral pathologist? Is, that is a branch of dental and maxillofacial surgery, or you can also say it's a branch of pathology that actually deals with the study of disease conditions and the diagnosis of diseases. Because most times, when you are, in short, when you're going to make diagnosis, it's you start from the clinical aspect. When the patients present to the clinic, you try to decipher what the conditions are and all that, and then you take specimens, that's a biopsy, which we check in the lab microscopically, and then make a histopathological diagnosis. So
that's huge and wonderful too. Thank you for bringing that to us. All right, let me come to you now, Dr. Mercy. We want to look at preventing oral cancer. Before we go into that, what is oral cancer?
Okay. I will start by telling us what is cancer.
Okay.
Cancer is an uncontrolled growth of abnormal tissue that goes on to invade and destroy the surrounding tissues. The abnormal tissue, they don't have control. They keep growing and growing out of proportion. And in so doing, they invade the surrounding tissue. They end up destroying the surrounding tissues. When you say oral cancer, it means cancer that is happening in the mouth. It can be any part of the oral cavity. It can be the tongue, the gum, the palate, the cheek, all of them, the lips. They are all parts of the oral mucosa. So that's oral cancer. So when you say, for now, from studies done all over the country, from the different geopolitical zones, they have prevalence studies of about 3 to 36% prevalence of oral cancer in Nigeria.
In Nigeria. So
it's a huge burden. We should look at that. But talking about 3 to about 36%, that is not the real prevalence rate of oral, because these studies are hospital-based. They're not community-based. You can't say what is happening in the community. But let's just say, okay,
that's for those that presented in the hospitals.
Many people, they don't come to the hospital. They just say, to try to manage, use alternative medicine and all that. And they come to the clinic when it's all bad. So looking at the question you asked me, the prevention of oral
cancer? No, before we go to prevention, we want to know the causes.
Okay, the risk factors, I will just say some, then Dr. Dixon will continue with some of the risk factors, because before you need to know what to prevent, what to do, so that first of all is from studies done in Nigeria and outside, the most important is smoking.
Is a cause?
Yes, smoking, excessive alcohol intake, exposure to sun. Excessive exposure to sun can cause cancer, particularly the lip cancer.
Okay.
Then some kind of nutritional deficiency. So these are found deficiency of vitamins like A, C, and E can cause oral cancer. Then some viral infections like EBV virus, Epstein-Barr virus has been implicated in Burkitt lymphoma. HPV, human papilloma virus, is now causing so much oropharyngeal carcinoma. Why? Maybe it's there in the genitalia. You can have cancer, cervical cancer, but because of like oral sex, can be it can get to the mouth, so it can cause oral cancer. Other viral infection. Then smoking. A study was done in the northeast, and they discovered that people that take alcohol plus smoking, smoking and
alcohol and tobacco go hand together. Okay.
That was one of the factors causing oral cancer, especially in the north. So those are some of the causes of cancer. Even immunosuppression, poor oral hygiene. All those are factors that are responsible. But the number one on the list that we should take is smoking, alcohol, excessive exposure to sunlight, then nutritional deficiency. Then from other studies in the north, cola nuts. I think cola nuts.
Apart from smoking, which other cause is prevalent here in Nigeria, in this part of Nigeria?
In this part, you know, when we say possible etiological factor, because nobody can actually come out and say, okay, this is what is responsible. All these are from studies done. Say, okay, the people that had cancer, this is what their habits and all that. From this part of the world, I would say from studies, I'm quoting study because I would love to quote studies. From studies done, alcohol has been there, smoking. It's even worse when the person is smoking and drinking. You understand? It's worse when the person is smoking and drinking. The alcohol, smoking, nutritional deficiency, because of the low socioeconomic class we have in this country. Poor people, poor nutrients, nutritional deficiency, poor oral hygiene. People are not coming for dental checkup. Demand is so poor. Areas, chronic irritation in the mouth. Because chronic irritation can go on to change the cells around. And the cells start becoming, they become abnormal. And they start growing out of proportion. And then somebody has oral cancer.
All right, so Dr. Dixon, what are the symptoms?
Okay, oral cancer.
How is one to know?
Yeah, well, it presents with varying kinds of presentations that ranges from just a swelling. You know, it starts actually as maybe a swelling or an ulcer.
Inside the mouth or around the mouth?
Inside the mouth. Like I said, it's oral cancer, simply put, it's cancers affecting the tissues that make up the oral cavity. You know, from the lip to the tongue, to the roof of the mouth, to the floor of the mouth, to the jaw bones and all that. So it can affect any part of these tissues. Any part of these tissues can be affected, you know, in this kind of condition. So most times they start as painless lesions, painless disease conditions. You know, maybe as an ulcer or a white area or a red area. You know, that's a localized red area in the mouth, and then that are not healing. You know, they are non-healing. Okay. Most times they'll tell you, give you a history that, or tell you that this thing has been there. They've taken antibiotics, and the ulcer, that's the wound. Ulcer is like a wound or a sore, actually. That it has persisted even when they try to do some local treatment around that. You know, so most times when patients come out like that and they give such history, we have to biopsy it, because biopsy will give the definitive diagnosis. You know, cancers are rapidly growing lesions. You know, lesions, I mean, disease conditions that grow rapidly. You know, that's why they are called cancers. They are malignancies. They're not like benign tumors that are slow growing. So most times they'll give you a history of a short duration. You know, they'll say this thing has been there for the past 3 weeks or the past 1 month. That means it's rapidly growing, unlike the slowly growing ones, which are the benign lesions that can be there for years. And those cases, most times the patients present late because it is slow growing. But these rapidly growing ones, which are cancers, they will give you that short, that duration, that history of a short duration. And at the initial stage, they are painless. They come as painless ulcers, that's like a wound or a growth. But over time, they can start becoming painful when it's infiltrating, because cancers have the capacity to infiltrate the surrounding tissues. When they begin to infiltrate, they infiltrate nerves. And you know nerves are sensitive, so the patient start having pain. Or when they become infected, especially the ones that are like wounds, ulcers in the mouth, that are persistent and not healing, they can become secondarily infected by organisms in the mouth, because the mouth is laden with microorganisms. So there can be infections affecting those ulcers, and then pain. Of course, pain is one of the characteristic features that follows inflammation caused by infection.
Okay, can we say that oral cancer is deadly, and then is it contagious? There's two questions as well. Let me go to you now, Dr. Mercy.
Oral cancer is deadly, but early detection can affect the prognosis.
That is where the problem comes in, because people don't present early. People don't present early.
Yes, it's deadly. And in this part of the world, what we commonly see in the hospital, patients present very late when they've gone to seek alternative therapies. Maybe they don't work, they're taking herbal mixture. They will now come, and then they are coming. The patient, believe me, the patient is almost gone. You can do little or nothing about it. So the best thing, the word for oral cancer is that early detection offers the best prognosis, because the 5-year survival rate is less than 40%. Why? Because they present late.
So
if someone presenting very late, even if you do surgery, chemotherapy, radiotherapy, all the treatment you do, the 5 years that the person will be alive for the next 5 years is less than 30%. That's it.
Less
so
than 30% and deadly.
It's not. We won't say it's contagious. It's
Okay,
not like
it's not
an
contagious.
infection that
Okay.
you say, but it's deadly if the patient doesn't present early. But if the patient presents early, there is hope.
All right, I'm going to show some pictures on screen now, and the doctors in the house will try, you know, x-ray the pictures as best as they can to you, so that you will understand. But adventure, there is somebody around you who has one or two of the symptoms, or the person is actually suffering from what we're going to show to you on screen. Please be guided and know that some of these pictures are quite disturbing. All right, so we advise viewers discretion. All right, so the PD will put those pictures on air now. Please use your discretion. They are quite, they are not so fine. They are not something you want to see every day. But we need to buttress some facts here, so that when you're having one or two of these problems, or somebody around you is having this, you need to like run. Everybody's talking about a coronavirus now. There are some things that are quite deadly too. So let's see those pictures now, and then Dr. Mercy and Dr. Dixon will talk to us about those pictures we're going to show on the screen. So like doctors, we're waiting for those pictures now. Okay. You see some, can you just describe what it looks like for somebody to have oral cancer? Just describe it a bit before the pictures come on. Okay. You know, because we've talked about the symptoms. Somebody will just say, oh, something smallish, something reddish, you know, it will grow. And some will go to, you know, there are some persons will say, I see them in town. I actually saw somebody somewhere around Lagos Street, and the person was like, they were dipping some kind of sharp object into the person's mouth. I was wondering what they were doing, but because the sight was not something I wanted to see, I couldn't wait to like ask what was happening. They said the person has some worms inside the teeth or something, you know, and somebody was trying to use sharp objects to like remove them.
Yeah. Oral cancer, like as I've said, you know, it's deadly, okay, and it's one of the most lethal conditions that present to the clinic, you know, and it's regarded as being among the top 5 of the conditions that we see in the clinic. As a matter of fact, it affects the patient. It's a big burden on the patient and actually on the relatives and the community. So it's seen more in the people from 40 years and above. Yes, it's not common in the younger age groups. Okay. You know, of course, oral cancer. Yes, it happens. Oral cancer varies. You know, the most common of them is what the one we call squamous cell carcinomas. And squamous cell carcinomas constitute over 90%.
Can you just break it down for us to understand what that is?
Yes, we have different forms of the cancers. Okay. So one of which is the oral squamous cell carcinoma, which is the common one.
Okay, it's Doctor, let's look at the screen and to see all of this. Okay, give us what this is all about, what we're seeing on the screen now. We had to blur some of those pictures because they are not something you want to see every day, but it's there. We cannot divorce ourselves from it. People suffer from this.
Yeah, what you're seeing right now, of course, these pictures are gory, so that's why, you know, it causes tissue destruction. You know, the word cancer is from, if the word means something that looks like crabs, crab, because of the way it infiltrates. They are aggressive. They are aggressive, locally infiltrating. And they are cancers because they have the capacity to spread to distant sites. So the primary site can be in the mouth, for example, like this one you're seeing. Yes. This is the roof of the mouth, where you have an ulcer. Like I said, an ulcer is a wound, a sore. You can see that that has the capacity to go far from the primary site to distant sites. And because a lot of patients don't present late, like that, these ones you're seeing, they started small. They started as a small area of a swelling that looks like maybe a groundnut seed or an eroded area. Very smaller, like a tiny, just small area that is eroded. The surface is eroded, you know, and because it's there and the patient there's no pain, the patient does not see
just
reasons.
Ignore.
Yeah, just ignore, just see everyday reasons.
Hoping
that it will heal. But when it now persists and it's not healing, it persists and it's getting bigger. If it's the jaw bones, you see the mass, it's enlarging and all that. Before you know it, there's tissue destruction and tissue loss. Because cancers, you know, they replicate. If you do not attend to it, you know, as long as the tumor has not been removed, it continues growing until there's an intervention, either using surgery or chemotherapy or radiotherapy. Okay? It's not like some other kind of growth that when you remove the stimuli that causes it, it will stop growing. But cancers are not like that. Even when you remove the stimuli that evoked that growth, they just keep continue growing until you intervene. So that's what cancers do. They continue destroying the tissues, and they destroy the tissues that will affect function. You understand? It will affect the patient's general health. You know, it will affect the ability to eat. You affect psychologically. It will affect the patient. The patient will be down. You know, patient will have fevers. The patient can become
everything will just go wrong.
They can become cachectic. They'll be losing weight. You know, they'll be having things like something like night sweat and all that. So you can see this one, for example, this one has actually destroyed the tissues and is invading into deeper structures. And it gets to a point that it gets too deep that surgical intervention alone cannot actually handle the situation. And surgery is for the early lesions, stage 1, stage 2 lesions. When it's beyond stage 1, stage 2, you now start going for other modalities of treatment.
Dr. Mercy, tell us about the stages, because Dr. Dixon just said there's stage 1, stage. Tell us about the stages of cancer, of oral cancer, rather.
If we have to go, because there are so many technicalities that people won't even understand.
No, break it down so that those of us out there will understand.
Okay, because we are talking about spread to lymph nodes, spread metastasis, that the distance spread from where the cancer is
from the primary side.
Because even from the mouth, some people have breast cancer, it will even spread. A time will spread to the jaw bones. I've had a patient that had bronchogenic carcinoma, and it came with pains on the jaw bones, and there was metastasis from the lungs to the jaw bones. It can be as bad as that. So when we start saying the different stages of cancer, stage 1 to stage 4, at stage 1, you say the best time is actually that stage 1, where there is no lymph node involvement
or metastasis.
Have lymph node in the neck, and because by the time there's lymph node, when you check the lymph node, it becomes matted, it becomes hard. You know that the survival rate for that patient is actually very low. So at the initial stage, like when the patient presents, their presentation can be an ulcer means a sore in the mouth. It might be there for like 3 weeks, it's not healing. It's just a small sore. You say it's not painful, but it's there. Because some patients have come to the clinic. We have made diagnosis of cancer patient that they didn't know there was anything. Just routine checkup. We now say, okay, there was an ulcer around the retromolar area, that means the back of the last tooth. And we just saw and say, oh, there's a wound there. Say, it's been there, it's not paining me. And say, oh, the way it's looking, the shape, because there's a shape it will have, it will not look like other normal inflammatory. So I would say, okay, let's just biopsy this thing. We biopsy, took to the lab, we look at it, say, that's squamous cell carcinoma. We have to quickly intervene and all that. So patient can come and say, I can't swallow, I'm having difficulty swallowing, or change the voice, or numbness in a particular area. Say that place is so numb, I don't have feelings. Then that means there's a cancer there, it's already infiltrating the nerves. You know, nerves have a sensation. Say, I can't feel it and all that. So the best time to call is actually stage 1, at worst stage 2. When you now get to stage 3 and stage 4. When you now get to stage 3 and stage 4, the prognosis is very poor, that even after intervention, the survival rate after 5 years is less than 30%. So stage 1, when you're saying stage, we're talking about lymph node infiltration and the distant metastasis. At stage 1, there is no spread. It's just within the area of affectation.
And it's manageable.
At stage 2, there is spread, but still to the same side, lymph node on the same side, and you measure, you say less than 3 cm involvement, 3 to 6 cm involvement. But when you're not saying about stage 3, stage 4, that means spread to distant
sites.
Lymph node, distant side, there's metastasis, and the lymph nodes, maybe lymph nodes on this side, the other side are affected, and there's really no hope for the patient. So when patient comes to clinic, what we do is we measure all these things, stage it and say stage 1, stage 2, yes, okay, surgery alone can take care of this. At stage 3, stage 4, we say, okay, we have to combine with surgery, remove the cancer, go to where the lymph node, try and remove the lymph node as much as possible, then you can add chemotherapy for all those distant metastases. You can add chemotherapy, or some we even go on to add chemotherapy drugs.
It's hard to believe that something happening in the mouth can actually cause a lot of problems to the human body.
Yes.
Okay, now let's look at the teeth. You know, sometimes you see some, like in one of those pictures, somebody's teeth was actually very, very dark, and then with blood and all of that. Can the teeth really, show somebody or tell that somebody is suffering from cancer of the mouth?
Okay, see, from that picture you show, it was actually the tongue.
It was not the teeth?
The tongue. The tongue was so enlarged that it came and you look at, because we should have said the common sites in the mouth where the patient can present with oral cancer. Okay. First in the mouth, you look at the side, the lateral aspect of the tongue. Those pictures we showed, 3 of them had cancer of the tongue. The posterior aspect of the lateral part of the tongue, it will just be there like an ulcer, like a wound, a small wound, just be there. And it's not healing, it's not painful. It's been there for about 3 weeks. High suspicion, because we've seen patients, we say cancer is seen in patients above 40 years. We've seen patients not too long, a 21-year-old undergraduate of a university, let me not mention university, we saw a lesion like that on the lateral aspect of the posterior aspect of the tongue. We said, this one, it looks, the shape of the lesion, it looks like squamous cell carcinoma. Okay, let's biopsy it. Took a biopsy, it became a squamous carcinoma in a 21-year-old student. Can't be that. So, patient, the side where you have them on the lateral aspect of the posterior part of the tongue, the side, the floor of the mouth. When the patient, tell your patient, raise up your tongue, the floor of the mouth, the retromolar area, at the last tooth, look at the back of it. You can have even the gum, the gingiva, the palate, that's the roof of the mouth.
It's not something toothbrush or toothpaste can cause?
No, toothbrush and toothpaste, no, it cannot cause. If we say like chronic irritation, it might not be from toothbrush. Maybe somebody wearing fitted dentures, replacement, artificial, maybe they have some wires and all that. It just causing trauma to a particular area. Over time, we can say, okay, chronic irritation can change the structure, the architecture of the cells around there, and they can begin to proliferate, all those kind. Or maybe poor oral hygiene that is so bad, and that's why we encourage, all those can cause irritation. It's not like the toothbrushing, they have not been for any study or the research we've not seen anyway say toothbrushing technique actually caused
that sometimes some persons, when they are brushing, if you're on the 3rd, 4th street, you actually know that somebody on the 4th street is brushing because of the way they
because they believe
the force and all of it. So sometimes they might just get injured or something.
Some people believe if they don't apply so much force, you have to teach them, let them teach them the techniques of brushing. It's not by applying so much or using a hard toothbrush, a medium-sized toothbrush with a fluoride containing toothpaste. Okay,
I hope when next you come, you're going to teach us that, because we'll look at that.
And for the tooth, the tooth, it can actually cause, when they infiltrate, like I said, they are infiltrating. They can infiltrate bone. The tooth is held in bone, in the jaw bones, exactly. So what holds it can be affected, broken down, and that can cause mobility of the tooth. When somebody says their teeth are shaking or something. So sometimes when patients, when they come to the hospital and they come with mobility of the tooth, you have to investigate further to be sure that it's just maybe inflammation of the gum that is causing this, or to be sure that it's not it's not cancer that is causing the mobility of the tooth, because cancer can destroy what attaches the tooth to the jawbone.
All right, our phone number is 052-290-573. 052-290573. The number will be on your screen shortly. Call the doctors. We have two of them in the studio, and they are ready to answer all the questions you want to ask. Don't ask your friend who is not a doctor. And after the program, I will not be able to give you a correct answer because I am not a doctor. So we have specialists in the house. And I have Dr. Mercy, I have Dr. Dixon, and they are here for you. So give us a call on 052-290573, and then they will talk to you. Whatever question you want to ask, okay? Particularly that sore, that little ulcer in your mouth, that is not pinning you and nothing. Maybe something as tiny as a granule seed or even smaller. You know, just call. There's no need to be ashamed of anything, okay? Call in and then you get all the answers you want to get. Looking at treatment, doctors, you talked about chemotherapy and surgery, and is it radiology now?
Radiotherapy.
Okay, radiotherapy now. So, how do those work?
Okay.
Two of you, you're
okay, surgery.
Yeah.
Like she has rightly placed it. The stage 1 and stage 2, in those cases, there's no nodal involvement, so it has not spread. The tumor is just a small tumor. Okay, they are measured in terms of centimeters, the size of the tumor. So between less than 4. Yes,
so.
For small tumors, surgery will suffice. Once you just walk around, they walk around the tumor and make sure that all the margins are free of tumor. Like I said, it infiltrates. So you try to go beyond. They go beyond the area it would have possibly infiltrated to get clean areas, to clear clean margins that are tumor free. You know, when that is done, the patient should be fine. You know, but in stage 3, which is said on stage 4, they now bring in other modalities of treatment, like the radiotherapy and the chemotherapy. So
after the chemo, the radiotherapy, how long does the person have to live?
Yes, there's what we call the 5-year survival rate. Do you understand? So after every treatment, some patients will be able to stay for up to 5 years. Especially for that long, they may be able. Okay. You know, if you get 5 years, for some patients, that's good. You know, especially for those that came late with high-grade tumors, high-grade stage 4 tumors, high-grade tumors. So if they stay for extra 5 years, which we call the 5-year survival rate, yes, you can get, you can be happy that you have done something for the patient.
Just 5 years.
No, like for some, like some cases, and some I've read about and research that if patient comes early, like when it's just starting, the 5 years survival you can even get up to like 60–70%.
Okay.
But if a patient comes, like what we see, if you see those pictures, they are all
actually,
somebody's jaw is already out, the tongue is already, you know, and the parotid gland there.
Exactly, I was going to talk about.
That's the salivary gland that is gone.
Oh, it was gone.
What has the patient be doing up to that time? If that patient comes and you treat, they might not even get to like 2–3 years.
Okay, let's quickly do this corner. Hello, caller. Good afternoon. Hello. Please, when you're calling, try and reduce the audio level on your television set so that we can hear you. If you do not reduce the audio level on your television set, we might just cut that call off, okay? Because the noise will disturb. Hello, caller. Good afternoon. Hello. Hello. Hello.
Hello.
Yeah, good afternoon. Can you reduce the audio level on your TV set or move away?
Hello.
Hello.
Good afternoon.
Good afternoon. Please tell us your name and ask your question.
I'm calling from Benin.
Okay.
Yeah. I just got to find out because sometimes my husband do complain that he has an hole on his teeth. I don't know if that is okay.
If hole in the teeth is part of having cancer?
Yes. Each time he gives me, he complains of him having pain.
Okay. All right, doctors, you heard the caller. Hole in the teeth, which is very common.
Hole in the teeth is not cancer at all.
Okay, but is it possible?
In a patient that has cancer. It's possible in anybody.
Okay.
Whether a patient has cancer or not. We call it dental caries, tooth decay. So it can affect everybody. In short, it's the commonest thing that we see in the clinic. You know, that's as a result of an infective process that takes place in the mouth where acids are being formed, organic acids. that dissolve the hard tissue, that's the tooth itself. And once the dissolution continues, and there's no treatment on time to stop the further dissolution of the hard tissue, there will be bound to be a cavity on that tooth. So that's not cancer at all.
Okay,
it's not related to.
It's not related. So put your mind at rest. All right. Hello, caller. Hello. Kindly do us a favor. Reduce the audio level on your television set. And if you can't do that, you move away completely from where you have your TV so that we can, you know, hear each other properly. Good afternoon. Hello, good afternoon. Hello. All right, while we're waiting for more calls, you did tell us that cancer can happen on the lips, the tongue, the inner lining of the cheeks, the cheek itself, and then the gums. The gums. I'm particularly concerned about the gums because a lot of persons do have issues with the gums often. Should that person be scared?
Well, you know, poor oral hygiene can affect the gum. I mean, the person maybe is not brushing twice a day. Is having deposits.
Must one brush twice a day?
Yes, it's very important. Brush
because sometimes some of us just forget.
Sometimes don't know that is how it should be. It's like eating 3 times
a
a day.
must.
Yeah, must brush twice daily to maintain proper oral hygiene. Because if the teeth are not clean, if there's poor oral hygiene, if it has calculus deposit on them, because they're very close to the gum, they're very close to the gum, they're inside the gum. All those because those calculus, those plaque deposit, they have bacteria. They release toxins.
Okay, doctor, let me hold you there. Hello, caller. Hello. Hello. All right, the lines will be jamming. Don't worry, just keep calling. Okay, doc. Sorry, I had to cut you off there.
Okay, like I said, because of poor oral hygiene, because when you say poor oral hygiene, means the person has deposits in the mouth, calculus and plaque, and they have microorganisms. They release toxins. They end up destroying the gum. So that's why we encourage brushing twice daily, regular dental checkup.
Okay. Hello. Hello. Good afternoon. Yeah. What's your name, please? Can you speak up a bit? Okay. So ask your question.
My teeth, my front is shaky. They have no pain.
Honestly, I can't hear you. I can't get a word of what you're saying. Okay. Okay, your teeth is shaking. Okay.
Okay, I think I get that. Like it's related to what you just said about the gum. Okay, poor oral hygiene, for example, where you have deposits, which we call plaque, calculus, tartars. You know, neglected mouth where the oral hygiene is poor, you're definitely going to have such accumulations. And if those things are not removed, maybe by scaling and polishing and all that, they begin to cause inflammation. They cause inflammation of the gum. And the inflammation, if not corrected early, will begin to progress. And it progresses to get to the things that hold the tooth to the bone. It begins to destroy the ligaments that hold the tooth to the bone and begin to destroy the bone around the tooth. And that makes the surrounding tissue that holds the tooth weak. And then you have mobility of that tooth.
Okay. Hello, caller.
It's me, Rose. I'll come back again.
Okay, Rose.
My front is shaking, but I have no pain.
Your front teeth is shaking. That means you weren't listening to the doctor when he was trying to answer your question.
Okay.
Okay, maybe he will answer it again. So listen, okay?
All right.
So you know what to do.
So like I just said, gingival inflammation over time that can arise as a result of maybe poor oral hygiene, where you have calculus, plaque that are deposited on the tooth. They begin to cause inflammation on the gingiva, on the gum. And this inflammation can continue to progress into the deeper tissues because these are microorganisms that are causing this. And these microorganisms release some mediators that destroy the tissues that hold the tooth to the bone. And when this progresses unabated, they destroy the surrounding tissues and the tooth becomes mobile, which some people call shaking. It becomes mobile. So in that case, the patient has to present to the clinic so that we elicit what would have resulted in that and institute appropriate treatment.
There's trauma too. Maybe the patient had trauma like accidentally hit it to somewhere. Over time, they took mobile. So the best is to come to the clinic. We take a proper history. We are able to, even with a patient with cancer, they can start with like an ulcer or a swelling that infiltrates to the gum, destroy the alveolar bone, and the tooth becomes mobile. So many things can cause tooth mobility. For the patient to come down, we examine, do investigation, we can say, okay, this is what is responsible. The major cause of tooth mobility is actually poor oral hygiene, progression of poor oral hygiene.
Okay, you talk about alcohol being a risk factor. Unfortunately, where you see sometimes people will complain of toothache or hole in the teeth or something, and the next thing they are going to get, you know, alcohol to like treat it. Is it right? You answer that question after this call. Hello, caller. Good afternoon. Hello? Hello? Sorry, we lost that call. Okay.
Okay, like that's it. That's very wrong.
People do it. I've seen people do it.
Yeah, they do it.
You know, they come to the clinic.
Then they even put snuff.
And they put aspirin. They grind it.
And then put it inside.
And it spills to the surrounding, and they come to the clinic with sore in the mouth.
Okay.
We see it a lot. It's
So that's wrong.
It's wrong.
Yeah, it's wrong.
Because alcohol can actually be implicated in oral cancer. Excessive alcohol intake. But let me say that there are some patients that come down with oral ulcer that are not into smoking and drinking. So we can't all say because you drink and smoke, because I want to clear that some patients, oral cancer, maybe women say, I don't smoke.
They don't smoke, they don't drink.
So there are many, it's more, the cause, etiology of oral cancer is multifactorial. But what has been implicated is smoking and excessive alcohol intake can cause it.
Yes. Okay, tell us about oral hygiene, because you were talking about oral hygiene and some persons will be wondering, I brush my teeth, so you know, tell us more about oral hygiene.
Oral hygiene, you have to brush twice daily, and you have to do scaling and polishing at least twice a year. Come to the clinic. You don't do it. You can't do it at home.
Scaling and polishing twice a year.
We have an instrument that we use to clean, so that because there's some parts, sub-gingiva inside the gingiva, you can't get there. Some food can get. That's what some people will eat. Food is deposited. They are using toothpick instead of dental floss. The toothpick will now push the food even further, and it will decay and cause bad smell or cause irritation. They start having gingivitis, inflammation of the gingiva, and all that. So when you come to the clinic for scaling and polishing, they remove all those. All those are proper oral hygiene. So we said use toothpaste that has fluoride containing, just go look at it, read the label, it has fluoride or fluoride containing toothpaste. You use medium-sized toothbrush for almost everybody use. So that then drink plenty of water, it keeps the mouth fresh. As you swallow everything, then it goes to your GI and you can pass it and no problem. So those are proper oral hygiene. And even if there's no problem in the mouth, come for regular dental checkup at least twice a year. Okay,
Dr. Dixon, let me ask you this question. In this era of coronavirus, a lot of us are neck deep into garlic, ginger, onion, you name it. Does it have any effect on the mouth? Will it cause any damage?
Not damage per se. People, you know, like halitosis, for example. Do you understand? A lot of things have been implicated as causes of halitosis. You know, and the kind of food we eat, the kind of things we take, the kind of spices we take, things like garlic, you know, ginger, and all that. They have smell. You know, they have a way of bringing out some odor, which can actually be regarded as one of the causes of halitosis. Yes, yeah.
So apart from that, it does not have any other effect?
No effect.
Okay, so for those of us who take garlic, ginger, and all of that, I'm making a case for you so that we'll know exactly what we are doing. Hello, caller, good afternoon. Hello? Hello? All right, apart from cancer, what other disease can happen to the mouth?
Oh, a lot can happen to the mouth. I've said halitosis can happen, dental caries can happen.
Halitosis is bad mouth odor, okay?
Dental caries decay. When people have holes that they go out and put alcohol, put ginger, put topical and all that, and it causes happen in the mouth. The mouth can show a lot of systemic disease. If somebody I've been able to say, okay, this patient has HIV by just looking at the mouth.
By just looking at the mouth?
Yeah. Patient that's my area of oral medicine. We look at the mouth. Oral manifestation of systemic disease. Patient comes to my chair and look, I see some patient, I think the patient has GM, diabetes mellitus, and it's not well controlled. So it's having some kind of infection I know. Or the mouth is so dry, the person I touch the tongue with my spatula and it's sticky, it's not moving. I say, it's so dry, what are you into? I say, okay, let's check whether that patient has this. And they come out and, so the mouth can tell a lot.
Hello, caller. Hello, good afternoon. Hello.
Hello.
Yeah, hi, good afternoon. All right, please reduce the audio level. Okay, reduce the volume on your television set, okay? Reduce the volume or switch it off if you don't want to move away from where your TV is. Hello, caller. Hello. When you call, please tell us your name, where you're calling from, and then ask your question. Good afternoon.
Yes, madam.
Good afternoon. What is your name, please?
Please, Dr. Morris.
All right, please go ahead with your question.
Yes, how can I get in contact with those people that we are interviewing now?
Okay, you want to get in touch with them?
Yes.
All right, don't worry. They'll call out their numbers as soon as we're almost done with the program. So stay tuned.
Okay, thank you.
You're welcome. All right, that's part of our social responsibilities to get health close to you so that every Nigerian will be healthy. If you are healthy, the nation will also be healthy. Hello, good afternoon. Hello.
Hello.
Good afternoon. This particular voice has been calling me for quite some time. You just want to hear your voice on television. That is very wrong because a lot of persons really want to call in to ask questions and you are taking up time. It is wrong. It's part of being corrupt. Okay? Hello, caller. Good afternoon. Hello? All right, the number is 052-290-573. Give us a call, ask the doctor's question. Hello? Hello, good afternoon. Please tell us your name. All right, ask your question, please. Your chest. Center of your chest. Okay, don't worry. Maybe when we bring a cardiologist on the program, you'll ask the question, okay? We're talking about the mouth now. Oral medicine, oral hygiene, oral cancer awareness and prevention is what we are talking about. Unfortunately, doctors, some of us don't even know when something is happening to the mouth because of this use of alcohol and this issue of going to meet a friend. I beg, I have this issue, what can I use? And then all sort of advice will be coming out. Some will tell you that there are some persons who go around Benin City in small vehicles.
Yeah.
You know, you see people. Hello, caller, good afternoon.
Good afternoon, madam.
Thank you. Please tell us your name and ask your question.
My name is Akiri. I'm calling from Benin here.
You're welcome.
Please, I noticed on frequent that whenever I brush, coming out from my cleaner. So I don't know what the problem is.
Blood?
I don't know, anytime I brush, I talk or blood coming out from my cleaner. The after teaching season, the other tooth.
You got it?
The blood coming out from the mouth?
After brushing.
Okay.
Talk from my teeth.
Okay, from your teeth.
Yes.
So he needs attention. He needs to come to the clinic where he needs to be seen.
Okay.
Like I've explained before, you know, when there's an inflammation, you have engorged vessels. That means you have a lot of vascular activities, blood coming in, because there's an infective process that's taking place, and the body needs to fight whatever is the causative agent, the infection in this case, because the mouth contains a lot of microorganisms.
Okay.
You know, so you have a lot of blood flow to that area. This includes vascularization because there's need to bring lymphocytes. Lymphocytes are protective. You know, those are blood cells that help to fight, you know, invading microbial activity. So you have vascularization, a lot of blood vessels around that area, bringing in the lymphocytes and all that. So when you brush, the tendency for the bleeding to be there because these vessels are on the surface, and just a little trauma or irritation from your toothbrush will elicit such bleeding.
Okay, tell us about the recommended toothbrush that one can use, because some persons will say this one is smoker's toothbrush, this one is my situation is children's toothbrush. What? Okay, tell us about the texture of the toothbrush that a normal person should use.
Well, You know, I've been saying that for smokers, you say hard toothbrush. When you buy a good toothbrush, I don't want to mention, when you buy, get a good toothbrush, you will see the handle H. It means hard for smokers. You will see medium, M for medium. That's for normal people. The texture of medium is good enough for everybody. S, soft for children. Children less than 4 or 5 years. By the time you get to 5 or 6 years, you know you have to change to medium. So that's when you get a good toothbrush, you get M on it. The texture is good enough, and you get a fluoride containing toothpaste, not the herbal or anything. No, a fluoride containing toothpaste. Used to brush twice daily, morning and evening. Because
evening after food or before food?
Okay, what you do, if you after food in the evening you brush, so that when you are eating the following morning, you can actually take your breakfast before brushing. Yes. Okay. So when you do that, because even bleeding, when you say bleeding from the tip of the gum, it's a sign of poor hygiene. Patients that have poor hygiene, anytime they brush in the morning, little blood will be there. It doesn't. It's a sign of. It's not something that will cause you so much fear that. Because bleeding can be a sign of oral hygiene. Even people can cough. If they have TB and all that, they can cough and break. Like the person that said have chest pain, I want to advise the patient to go to the hospital. Go to A&E or somewhere or GPC, they will attend to you, because chest pain can be a sign of so many things that you don't want to. So the best thing, go there, let them examine and see you are okay. GBT is working. We are working even with the COVID era. We are still working. So you should go there and pay attention. So the bleeding can be poor oral hygiene. Even people that have say like oral cancer. One of the symptoms is bleeding. It can be bleeding from the tissue are just bleeding because of infiltration everywhere and there. So it's for you to come. But the most common cause of bleeding is poor oral hygiene. So let the patient come. You clear out all the calculus, all the gun that impinging and causing all this, but the patient will be well and good.
Okay, I've seen some discoloration of the teeth, and some are so bad. They're very dark as the dress you're wearing, and you begin to wonder, is this person having problems? No matter what they do, that color stays. Is there anything that can be done?
Okay, for discoloration, so many things can cause discoloration. When you say, like, I think the last time I was here, I mentioned something about discoloration, like people that are pregnant and children less than 12 years, if they take me like tetracycline, red capsule.
Okay. Okay, the yellow and red capsule.
Yellow and red capsule, yeah.
Okay. For pregnant women and for children less than 12 years, because the patient is going, the teeth are forming and all that. That patient will end up with generalized tooth staining. The whole teeth in the mouth will be dark or it's bad.
And nothing can be done?
Nothing can be done unless you go, they can put crown, you treat it, they cover the surface, they prepare and cover. But if you say you want to leave it like that, it's going to be very bad.
What about if it's happening in children? Is there anything that can be done?
If it's happening in children?
Maybe 3, 4, 5, 6 to 10.
In children, if it depends on the cause, because even there are some mouthwashes like chlorhexidine. If you use it for like over a week, it will stain the teeth. There are some food you just eat, like all those iron supplements in children, iron syrup. It can stain the teeth, but when you brush it off, it stains. Those are extrinsic staining. But those that will cause intrinsic staining, like this tetracycline, no matter the brushing, the child is going, even after the primary to secondary to it will still continue. There are also some defects, genetic defects that can be generalized. And all that.
All right, doctors, our time is fast spent. I would like you to tell us again what we should do to prevent oral cancer. What are the things we should do?
Okay. The first thing we should do is that today we have come to cause awareness. And prevention of oral cancer. Yeah. Tell people that oral cancer is there, and these are the signs.
And they should not toy with it.
Not toy with it because it's deadly.
Okay.
And early detection offers the best prognosis. We should not forget that. And secondly, the awareness in Nigeria is very poor because of the low socioeconomic group, illiteracy, and people knowing that alternative therapy, I can always go to the herbalist and do something, and they cannot help you. They can't help you. So the best is that know the risk factors. That may be possible. Know the risk factors.
Go ahead, doctor.
The things that can cause oral cancer, when we have said number 1 on the list, we have said smoking. Yes. We have said excessive use of alcohol. We have said excessive sun exposure can cause lip cancer. We have said something like viral diseases like HPV, and HPV can be able through oral sex. Oral sex. You can, then nutritional deficiency, somebody is not eating well. Eat plenty of fruits and vegetables. Not all this canned food and all. Plenty of food. They have vitamins, antioxidants that can help you fight infection and all these free radicals that can cause cancer. So you need plenty of that. Eat well. they call for regular dental check so that if there's any chronic area, chronic irritation, poor oral hygiene, you can take care of that. And also, I told you a study showed that even kola nut in the nuts, because a study they said smoking and drinking plus kola nut was responsible for their cancer. So we should avoid all these things we have said. And we must come for regular dental check because early detection, once you come, we suspect, oh, this is not just a normal wound or a normal ulcer, we suspect, and you can biopsy it. You can biopsy it, and you can take care of it from there.
All right, doctors. Thank you so much, Dr. Dixon. I know you want to say something. And don't forget to call that number out, okay? Because I did promise somebody that you will call the number. All right, doctor.
And also I think there's need for the community leaders and then even the government too to come into it in trying to increase awareness. Okay. Because when people are aware of certain things, they take action as regards their health. So they should come into increase awareness.
As if most of us are not aware. It's just that nothing is going to happen. Let me just manage. That kind of
thing, and
you know, that kind of thing.
Yeah, and apart from that, it's important for us to know that these factors that has been enumerated here are actually regarded as predisposing factors, risk factors. It doesn't mean that if somebody is exposed to suffer a long time, he may actually come down. But the chances of having oral cancer is there when all these factors are interplay. And then there's also a genetic predisposition too. You know, when there's yes, there's a genetic predisposition. You know, all these things are the information that makes us who we are is actually resident in our DNA. Okay, so this information that resident in our DNA. Okay. So and then you have what we call replication taking place, and these replications are the things that causes cells to divide. Okay. And then, of course, as they are dividing too, you know, we can transfer things to our offspring. So that's why sometimes they ask you, do this kind of thing happen? Is there anybody in your family that also has this kind of condition?
Okay, all right. Thank you very much, doctors, for finding time to be with us on the program. I did tell that caller that I was going to give you a number to call, so you can do that on 080-7708-2732. All right, call that number to do a follow-up. And if you didn't get that number, call me after the program. I'll give you the number. Thank you very much for being part of the show. We'll see you again on Monday. Happy Salah and happy Children's Day.